Bismillahirrahmanirrahim. Today we are going to talk briefly about the coronavirus, the COVID infection, that's the pandemic that is going on and its effect on the heart and how to prevent and what precautions to take and what to do with it. To start off, the virus can affect the blood supply to the heart, which are the coronary arteries, which give blood to the heart muscle and cause a heart attack. It can also affect the heart muscle directly, causing the heart muscle to be damaged, and we see this in about 20% of the cases. The infection causes release of excessive amount of chemicals in the blood, which causes inflammation, swelling of the arteries, swelling inside the muscle of the heart, rupture of the plaque, and excessive strain on the heart. The virus also causes excessive blood clotting in many organs of the body, including in the lungs, in the brain, etc. The virus primarily, as we know, affects the lungs, causing severe pneumonia, and it causes blood clotting in the arteries that give blood supply to the blood supply to the lungs. And this produces excessive strain on the right chamber of the heart, which has to pump blood to the lungs, and that causes the right heart to fail. The virus can cause rhythm disturbance of the heart, and certain medications that are prescribed can aggravate it, together with also low chemicals in the blood such as low potassium and low magnesium that can affect the rhythm disturbance in the heart. As you can see here, this is the diagram of the heart and lungs, and on the slide here we can see the heart gives blood supply to the rest of the body by the left chamber of the heart. The right chamber of the heart gives blood supply to the lungs by these arteries. When there is a rupture of the plaque in the coronary artery, which gives blood supply to the heart, and the artery blocks down completely, the heart muscle undergoes damage, as it is shown in the gray area here, which is a heart attack, which weakens the heart muscle. As I mentioned earlier, the virus can directly affect the heart muscle also, weakening the heart muscle. It can cause blood clots to form in the lungs, which already have severe pneumonia in them, and this produces excessive strain on the right chamber of the heart, which has to pump blood to the lungs, and that makes the right chamber of the heart to enlarge and fail. So these are multiple ways that the virus can affect the heart. So if a patient gets COVID, who are the more likely to have a severe illness? Those who are older, like over the age of 65 years, those who have a obesity with a BMI of greater than 30, if there is underlying already heart disease such as coronary artery disease with patients with angina pectoris or previous heart attacks or previous bypass surgery or coronary stents, those are people who will have more serious illness if they catch COVID. Also, people who have a pre-existing weak heart or heart failure will have a more serious illness. People who have previous chronic lung disease, those who have diabetes, chronic kidney disease, those who have previous organ transplant such as kidney transplant because they are taking some medications which are immunosuppressant, then they can get more serious illness. Whether high blood pressure by itself or past history of stroke or dementia or moderate to severe asthma or pregnancy makes the COVID infection worse, it is still not clear. This is the data from the Center for Disease Control as of June 25th of this year. In the New England Journal, there was an article also about the outcomes of patients with serious COVID illness. Those who are over the age of 65, if they get COVID, then the chance of mortality, chance of dying is 1 in 10, that is 10%. Patients with the underlying coronary artery disease also have a similar 10% risk of mortality. Patients with heart failure have 15% risk. Those with a heart rhythm disturbance, about 11%. Chronic lung disease, 14%. Current cigarette smokers have 9% risk of mortality. The question is, are there any medications that can help or harm the heart if one gets COVID. The trials are ongoing to find medications for the virus as well as vaccine for the virus, and so far do not have any definitive answer yet. We asked whether certain medications that the heart patients can take, can they continue taking, for example, blood thinning medication like aspirin or certain medications which we call beta blockers like metoprolol, bisoprolol, and cholesterol lowering medications. These neither harm or benefit the heart, although the cholesterol lowering medications in patients who have underlying coronary artery disease is been found to helpful in patients with COVID. Again, the studies are still ongoing. Certain high blood pressure medications such as losartan or ramipril initially were thought to be harmful, but later studies did not pan out, so they are not found to be harmful to the heart. However, certain medications like the old malaria medication hydroxychloroquine, which as you remember was touted by President Trump, has been found to be probably harmful, and many of the trials have been stopped with this medication. It can cause serious rhythm disturbance and cardiac arrest. Very recently, a steroid called dexamethasone in UK was found to be helpful in patients who have serious lung disease from the COVID infection. The bottom line is not to stop or start any medications without talking to your doctor. Now, those who are at risk of having serious illness do not necessarily mean they will get COVID, nor does it mean that they will have a poor outcome. But we have to practice prevention. And how can we do that? If you remember, Maulana Hazir Imam in Istalika Mubarak of April made an observation and farman that, quote, maintenance of best standards of personal hygiene and practicing a notion of physical distancing, unquote. What does that mean is washing hands with soap and water for at least 20 seconds frequently, or use of hand sanitizer with at least 60% alcohol to kill the virus. Keep a distance of 6 feet between you and other people when you go out. Clean and disinfect the surfaces that we frequently touch, like the doorknobs or light switches or phones. Avoid touching the face or nose or outer surface of your face mask when you're wearing a face mask. At the current present time, wearing of the face mask in public is recommended. It is important to have a healthy diet and exercise to maintain a good physical health. Moreover, one should remain positive and have positive social interaction to have a good mental health in these trying times. What should one do if you suspect you're having some symptoms of heart disease while the COVID pandemic is going on? Some people who get heart symptoms like a chest pain or breathing difficulty or rapid heartbeat or lightheadedness or fainting, although they may be thinking they're having heart problem, they are reluctant to go to the hospital during pandemic for fear of acquiring the coronavirus infection. Here I would like to reassure you that the Aga Khan Hospital, Dar es Salaam, has taken excellent precautions to try and segregate COVID-proven and suspected patients from other parts of the hospital. So hence should not delay seeking medical help, which could be life-saving. The hospital also provides the state-of-the-art treatment with the latest available research. We must remember that the pandemic will not last forever, but you need your heart for a long time to come. My best wishes to you, and Ya Ali Madad.